One of the key core offerings at Best Doctors is what we call the interconsultation. The interconsultation is an expert review process. Often the elevator pitch is that this is a, quote, virtual second opinion. While this does describe, in some regards, the process, I think it does it a bit of a disservice, and I would like to point out exactly what this interconsultation process is all about. It begins with knowing the patient. Step one in this whole process is really an in-depth clinical interview done by our clinical team. When a patient calls Best Doctors, they are assigned to a doctor, a nurse, and a medical record specialist. After this in-depth intake, we go about the work of actually collecting all relevant medical information. After the patient signs the release, we go out to doctors' offices and hospitals to collect the actual office notes that are so important to understanding the case. In addition, we collect actual imaging, the CTs, the MRIs, the bone scans, and have a cloud-based image sharing platform where we host all of these images. We repeat the pathology. We collect both stained and unstained, and then have that repeated at a world-class lab. After all of this clinical information has been collected, we have a group of physicians who focus on this data, integrate it with that clinical intake, and produce a very comprehensive clinical summary. At the end of this clinical summary, we have about 10 to 15 questions that we are going to pose to the expert specifically about this case. Also, if the member has any specific questions about their care and treatment, we're going to include those questions as part of our clinical summary. The next step is having the case go through our physician services department, where we look at our database of over 50,000 experts, and we select the right expert based upon their inclusion in our database, their clinical research, their position within the current academic community. And we send the case to the expert, at which time they are able to review the case, review all the diagnostic imaging, the pathology, the reread of the pathology, and then they produce the expert report. This expert report is then placed upon the actual institutional letterhead of that physician and is thoroughly available to the treating physician who will receive the report at the end of the process. The next step is that the report is returned to Best Doctors, and our in-house physicians review the report, make sure that it's evidence-based, make sure that all of those questions were thoroughly answered, make sure that relevant literature citations have been included within the report. They then produce a Best Doctor report summary to make the report very user-friendly for the patient, and then we communicate that report back to the member and to their whole treating team. The final step is that we want to make sure that we're not in the book report business. So we have a clinical follow-up program where at 3 weeks and 3 months following this process, we're following up with the member and the treating physician to ensure that the treatment recommendations were actually implemented in terms of the patient's treatment plan.